Can apps put coronavirus in check? Countries rush to introduce the tools to track the spread of the pandemic. But how effective are they? And do they endanger other human rights? This is Inside Story. Hello and welcome to the show. I'm Sami, Zeidan. Health officials and tech companies around the world have been racing to develop smartphone apps to control the spread of coronavirus. Some governments may be weighing rights violations and mass surveillance, but others have adopted the technology. Singapore is one of the first countries to launch a non-mandatory contact tracing app using Bluetooth signals. Australia, Malaysia and the UK have followed suit. There have also been apps that go beyond contact tracing, notably in China, where a system has been built to collect people's health data and travel history. India and South Korea launched similar apps. Members of the European Parliament discussed the pros and cons of tracing apps in a recent debate. The European Justice Commissioner says the technology should only be used during the pandemic.
The personal data should not be kept for longer than necessary. Timelines should be based on medical relevance. In addition, the apps should be only used during the crisis and be deactivated at the latest when the pandemic is over. The deactivation should not depend on the installation by the user.
Let's take a closer look at how these tracing apps work then. South Korea created a public database of COVID-19 cases that gives details of everyone who's been infected. The system tracks their exact movements and updates from card transactions, phone signal data and CCTV footage. Singapore's app is more limited and only 25% of the population is actually signed up. When a person tests positive, health authorities can see their Bluetooth history and order those they've had contact with to quarantine. The UK is trialling a test, track and trace program on the Isle of Wight. Like Singapore, it uses Bluetooth to detect when a person's phone has been near another owned by someone reporting symptoms of COVID-19. And Qatar has an app linking users to a health ministry database. It assigns QR codes to differentiate between suspected, confirmed and quarantined cases. All right, let's bring in our panel. Joining us from Doha is Dr. Patrick Tang. He's the Division Chief of Pathology Sciences at Sidra Medicine. From London, Nishanth Sastry, Senior Lecturer in the Department of Informatics at King's College London. And from Rotterdam, Ali Fenwick, a behavioural psychologist and Professor of Organisational Behaviour at Hult Business School. Good to have you all with us. We can start with Dr. Patrick. So, to what extent have mobile phone tracking apps actually proved effective so far in helping to contain COVID-19?
Well, I think there's a lot of promise for these different health status apps and tracking apps for being part of the picture in containing the COVID-19 outbreak right now. There's a few countries around the world that have started to use these types of apps to track their population and monitor their health status. And there's many other countries that are considering adopting this technology, and there's many companies, private companies, are also trying to develop apps for this purpose as well too.
Ali, can people be motivated to carry their mobile phones at all time, make sure the battery is always charged and the Bluetooth is switched on? It seems like the effectiveness of these apps depends on a lot of things related to human behavior.
Well, I think I think human devices has become so integral to our lives. We spend numerous hours a day for work and also for our private lives using mobile devices to communicate, to be informed about stuff. So yes, we have become very much accustomed to using mobile devices, and how it basically also affects behavior depends on that, this what I basically call the human to digital interaction. But still not much is known of how the digital device affects human behavior, because it's become so integral in our lives, it definitely is having an effect on human behavior. And also because of how devices might be used or the content that's provided, our interaction with this has a huge impact on how people decide or even behave, in that matter of fact.
And Nishanth, we should make it clear that not all of these apps are the same in some of the basic parameters and definitions. For example, in the Singapore Trace Together app, well, it considers contact with an infected person to be if you've been within 2 meters of someone who is infected for 30 minutes. But if you look at another app, the Australian app, well, they define it as being in the proximity as 1.5 meters for 15 minutes, right? So there is a big variation in parameters here, correct?
Yes, indeed. So most of these apps, if not all of them, rely on Bluetooth technology. And Bluetooth is basically a very straightforward sort of protocol which can record which other device is close to you with a range of up to 10 meters. And it can also go through walls, so it doesn't necessarily mean if you're, let's say, in a flat and you see some other Bluetooth device that you would have caught the coronavirus from that other person, because it might just be that you're on different floors. So there's issues about whether it completely and accurately and faithfully records all of the actual contacts that you've had. And furthermore, there might be issues of omission, as the previous speaker said about, well, if somebody has forgotten to take their phone with them, or if they simply choose not to use these applications. So there's a number of factors which will determine the effectiveness of such an application if it were to be deployed on a society-wide scale.
Especially on the point that you mentioned, there could be a wall or a floor between you and the other person that the app doesn't see because it's just connecting Bluetooth. So, Dr. Patrick, overall, how scientific are some of these parameters if it can't see through a wall? Or, if the parameter is being set differently between countries that are using this technology? I mean, coronavirus, I assume, behaves the same way in Australia as it does in Singapore.
Well, that's an excellent question, and there's no perfect answer for that. So none of these apps are going to be perfect, and what they're going to achieve is risk reduction. So,
but is there a scientific basis for why, for example, in Australia, they look at 1.5 meters as the sort of critical distance, and in Singapore, they've defined it as 2 meters? Is there any kind of scientific basis for that you know of?
So, it's not an exact measure whether it's 1 meter or 1.5 meters or 2 meters, right? It's not that if you're exactly 2 meters away, you have zero risk, and when 1 meter has 100% risk, right? So it's a gradient, right? And it depends on the epidemiology within that country and their modeling about what they feel in their jurisdiction is the most appropriate measure for achieving the risk reduction that they need to control the outbreak in their region. So it's not going to be the one solution. These apps are not going to be able to control the outbreak by themselves. We still need to do hand washing. We still need masks. We still need to do some degree of social distancing and quarantine and isolation and testing. We have to do lots of testing as well too. So these apps are part of the solution. They're not going to end the outbreak by themselves.
All right, so I guess the same thing applies to the number of minutes of exposure to an infected person, right? Whether it's 15 or 30 minutes. This is, well, I don't want to... Are we basically talking about guessology here?
Yeah, those are all, different measures in terms of what's achievable in that, what's realistic in that jurisdiction, in that region, and will that achieve the risk reduction that they need to control the outbreak. So I think in every country, they've looked at all their numbers and they've decided that 1.5 meters might be good for them, and another might say 15 minutes is good for them. But that's based on their own modeling of their population and the behaviors of their people in their population.
All right, on that point of behaviors of their people, let's bring Ali in, since you're a behavioral psychologist. To what extent do behavioural factors really make a difference with the operation of these kinds of apps? Like, in other words, are authorities sitting down and thinking, okay, I have a population that generally will wear masks and gloves properly or not in deciding how I set these parameters?
Absolutely. Look, I think, first of all, behavioral design is fundamental to any kind of app design. Because when we think of apps, we think of it as purely a digital something, but there is a lot of behavior that goes into the actual design of things. When we look at now, for example, tracking devices, I think the general response so far has been, well, we do not want to be tracked. And the reason has to do with the fact that people's, personal freedom has been limited, for example, already due to the pandemic, the lockdown, the curfews, social distancing, and now a tracking device to kind of track you as well would feel to a lot of people that their personal freedom is further being kind of imposed on. However, I have to mention here that we use social media apps on a daily basis, some of us even 7-9 hours a day. And what people are not conscious of is the fact that there's so much data already being given or being collected through these different apps, our personal data, who we engage with, what we buy, what we do. And this information is actually being used to repurpose it back into us to have as byproducts and other stuff. So I think what we definitely need to be conscious of is the fact that there's already many apps out there that are actually using our data. And we're voluntarily doing so because we're enjoying the app so much. But when it comes to the tracking device, we feel that we're being tracked, and therefore all of a sudden we say no to that. And I really think in this purpose, when we design, let's say, these apps, the purpose of the app needs to be made clear. So if as the previous gentleman just mentioned, if this app is being used to help us to be notified and informed and to make better decisions for ourselves, then I think people will be more acceptable to using these kinds of apps to help us make better decisions for ourselves.
All right, we'll get more later into the question of privacy with these apps, but if I can come back to the question of how parameters are being set in these apps. Nishanth, I wonder whether you're seeing any evidence of governments or authorities setting the parameters based not on what they think is simply effective in terms of tracking the spread of the virus, but also in terms of how many cases they can track and have the resources to track. Because explain this to our viewers, but basically if you set the parameters too wide, you can end up having to track down half the country, right? And if you set them too narrow, it can become pointless because you've got so many few cases, right?
Exactly. So imagine you're actually, you've got a number of points on a plate, and they're all being sprayed randomly with this virus, right? Now, what you're intending to figure out is how many of them have actually been sprayed with the virus, how many of them have been infected with the virus. And one way to do that would be to test every single point out there on the plane, each point now representing one citizen of your country. Now, if it is the case that most of them have been sprayed, then to effectively contain them, the only way to do that is through testing, through proper testing of every individual in your country.
And that's very difficult,
what we are
obviously.
doing here, and that's very difficult. It's a lot more expensive than the approaches that we are considering here with these proximity tracing or contact tracing applications. And the idea here is that if I know that I have been infected, if we can trace back where I have been in the past 5 days, because that's sort of known to be the number of days, roughly speaking, of the from when I get infected to when I start showing symptoms. So I know that I've been infected after I see the symptoms, but if I go back 5 days, who was I in contact with? And if I can trace them all, then we can tell them to self-isolate, and they will then not spread the application. So there's a subtle point here. This proximity tracing or contact tracing application does not actually protect you if it notifies that somebody in your vicinity has actually been infected. You've already been exposed to the virus, and therefore you will not be safe. But what will actually happen is that you, if you're being careful, if you're distancing yourself, staying within your home, you will not then further infect other people. And this is critical for at the stage that the virus is today, with a reproductive number slightly more than or slightly less than 1. So what we want to do is to bring that R, the reproductive number, less than 1. And the more we can do to prevent every secondary infection from happening, the better we will be as a society. So this is not something that I would deploy just because I want to selfishly save myself, but it's rather a solution which will protect the society in general if most of us adopt the solution. And so that's I think the key behavioral aspect there as well, is that it's something which I'm having to do altruistically. And if enough of us take this altruistic approach of let's install this application that the governments want us to install, never mind the privacy because there's a huge societal implication here, then perhaps it can have a benefit on a whole civilizational society level scale.
Right, okay.
But it doesn't do anything to me.
Getting into the issues of privacy, but before we make that shift, Dr. Patrick, I want to ask, Nishanth made it clear there that it's helpful, and you've made that point. Is it helpful, though, with the majority of cases of transmission, how we understand this virus transmit? Correct me if I'm wrong, but most cases, are they not transmitting through things like being at the time of when somebody actually coughs or sneezes around that person, or contact with an infected surface? Two situations which the app doesn't really help that much with, right? Because you could be close to someone for a few seconds and the app wouldn't really see that as within the parameters of your 15 or 30 minutes. Or you could be in touch with an infected surface where there's nobody else's Bluetooth is on and around you.
Well, I think it's a little bit more complicated than that. It's not just being around someone that's coughed for like 1 second, right? It's a probabilistic event, right? So just being close to someone that's coughed, it doesn't mean that you have a 100% chance of acquiring the infection. There's definitely many different parameters and variables that you have to take into account to assess your real risk. So definitely the amount of time you spend with someone that's infected is going to increase your risk. But as you've said, you cannot reduce that risk to zero, because you might have just be unlucky, passed by someone that coughed right at the right time and inhaled enough of that virus into you to become infected. So these apps won't protect you 100%. But to add to the last speaker and what he was saying is that there can be some individual benefit as well too. So if we look at some of the more primitive versions of this, like during SARS, if you opted in to be tracked, then the individual benefit that was going to be given back to you is that if you walked near a building or within a kilometer of a building where there was a large outbreak, then your phone would then notify you by SMS back then in 2003 that you were in an area that had a lot of SARS. So the same kind of thing could also work for some of these apps, that if you were entering a neighborhood or a building or a place where there was an outbreak, it could also warn you as well too. So there could be some individual benefit, but definitely it's correct that the most benefit of these apps would be for the society in general. It will be more of an altruistic type of thing rather than individual benefit.
Right. Well, let's talk a little bit about some of those concerns when it comes to wider society. Ali, are we at a situation where there's been a shift in the thinking amongst many people, at least, a more compliant population now asking to be monitored because they're worried about their lives?
Well, there is a shift, absolutely. So there will be there's differences in how people respond to a tracking device. And there's some people who really, really care about their personal health and of course of those of their loved ones. And they see the absolute benefit in having such devices. But remember one thing, the purpose of how the device is being used and how it's tracking you, what kind of information is it being used and collected from you, and what will happen with that information later will play a huge role in how the rest of the population accepts these kind of tracking devices. Because I think we have a lot of memories of the past and how, for example, information has been used or how information is currently being used for other purposes than just the purpose of the current app. And I think that's why it's really important to get that message clear to the public, but also in the design. So transparency and trust is so important. If for those people who kind of feel very fearful
if I could jump in there, since you said there transparency and trust in the design, Nishanth, anything that you know about the designs of these apps so far that prevents them from being misused, shall we say, to prevent or limit and interfere? Some human rights organisations are saying they could be used to do things like prevent freedom of movement and association for political reasons.
Absolutely, yes. So this is, it's basically equivalent to some of these prisoners who are sometimes let out, but with a tag to them, right? And they can be completely tagged, right? And that's a slightly incendiary sort of analogy to use, but that's the sort of power that could potentially come from these applications. Now, so this is exactly the reason why many governments are taking a highly transparent approach, and there should be a good amount of oversight to make sure that the data that has been collected is not being misused for any other purpose whatsoever. There are a couple of different ways to do this. One is more of a centralized approach where all of the data is collected and kept in one centralized database. This can make certain processing slightly more easier, somewhat more scalable as well. But it does lead to possible compromises. It may not necessarily be the government that misuses it. It could be that server where the data is getting stored may get compromised without the government even knowing about it, right? So that's a possibility. So a second way in which people are dealing with this is a decentralized approach, and the real sort of technical level discussion that's happening is whether the centralized or the decentralized approach is the appropriate one. One favors privacy more, one favors better tracking and perhaps better isolation.
Okay, let me bring in Dr. Patrick, because there is quite a variation between these apps. If you look at the South Korean app, for example, it does log locations a lot more than the Singaporean app. From a medical containment perspective, Dr. Patrick, how important is it to have a lot of data logged about locations, not just, whether or not you've been close to somebody that could be infected, but to have the locations all the locations that you've been to?
All of the data that's collected, whether it's location data or proximity to other people that might be infected, are important in certain circumstances. So,
so you'd support more the South Korean model, would you, and say we need apps that log absolutely as much as possible?
Well, if the data is used properly, then that is helpful. All data is helpful, and because it takes a lot of time to gather that type of data. If you had humans going and calling people and having these individuals have to recall the places that they actually went to. So if there was a way to access the data only when necessary without invading the privacy of individuals, then that would be useful.
Okay, I think we've got time for one quick question. Ali, any guarantees that this data won't be used beyond the pandemic when it's over? I mean, looking at the behavior of governments in the past, once they get powers, they seldom give them up, right?
Well, I think it's a great question. And again, we can take learning from how data is currently being used or how it has been used in the past. And read the terms and conditions of many apps. And there it already says that, that your data can be used to be sold to marketing agencies, or maybe even used for law enforcement in terms of national security. So,
and we just click agree without reading those terms, don't we, usually?
Exactly. Yeah, exactly. And because often these terms and conditions are bigger than a 100-page document in some cases, people just don't want to read it. They just quickly want to kind of press OK and go along with it. But I do think we need to be conscious of how this data is being used. And for the people who are developing these apps, they need to be very transparent. And especially when we're using for tracking purposes, that maybe there should be a limitation or an end to when the data is being used.
All right, it's good to have that discussion with all of you. Thank you so much. Let's thank our guests, Nishanth, Ali and Dr. Patrick. And thank you for watching. You can see the show again anytime by visiting our website, aljazeera.com. For further discussion, head over to our Facebook page. That's facebook.com/AJ Inside Story. You can join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Sami, Zeidan, and the whole team here. For now, it's goodbye.